So there's some important differences to highlight when it comes to delayed cord clamping. In a hospital setting, delayed cord clamping may be defined by 60 seconds or greater. In an out-of-hospital setting, it's often defined by as long as the person is wanting to delay that cord clamping. Keep in mind there may be instances for medical reasons, especially with like hemorrhaging, that cutting the cord quicker could be indicated. The research shows that it actually delayed cord clamping increases the newborn's hemoglobin levels at birth. It also improves their iron stores, and it also helps baby to continue getting oxygen while baby's figuring out how to breathe. So when the cord's ready to be cut, there will be a sterile package containing the clamp and also a sterile package with the cord cutting scissors. To place the clamp on, it will be placed about 1 inch from the baby's belly right onto the umbilical cord. The scissors will then be used to cut the umbilical cord. You want to make sure that it's being cut away from the baby next to the clamp as close as possible. And then that will be cut. And then these scissors could be handed back to the assistant, whoever's there, so that you don't have to hold them. So it's important to note that these scissors, sometimes you might have to take a couple different cuts. Be sure not to like pull or twist, and that you're opening them all the way and then cutting all the way through. It also can be done in the tub or wherever like the immediate postpartum recovery is happening. And then making sure that we hand these back to a person so they don't end up in the bed because they are sharp. So a demonstration of this, I performed proper hand hygiene and I'm wearing gloves. It may be a support person of the birthing person doing this, and you can have them wear gloves if they want, but most importantly is making sure their hands are clean. This sterile package is open. It is placed on the baby's umbilicus. It is clamped down tight. Once that clamp is in place, you can hand whoever's doing it by hanging onto the sterile package, making sure that only that person's touching the cord scissors, taking them out of the package, and we are cutting as close as we can to the cord. Once that's cut, these get handed back to the person to make sure they're not ending up in the bed.